Well, statistics show 100 people die every day from a drug overdose in the United States, and 3 out of 4 of those are caused by prescription painkillers. But a big policy change is expected to have a nationwide impact. News 8's Brittany Schmidt joins us now live in our newsroom to explain.
Mike, for many years, hydrocodone-containing products have been widely used as painkillers. It is usually mixed with acetaminophen and ibuprofen. But because of the addictive nature of the opiate, the U.S. Drug Enforcement Administration is putting tighter restrictions on it, hoping to reduce the number of drug overdose deaths across the nation.
This is in response to what's happening across the nation.
Over the past 20 years, drug overdose deaths in the United States have more than tripled.
If you look at the statistics, patients die of opioid overdose much more often than they die of gunshots or drunk driving accidents.
Dr. Michael Dolan at Gunderson Health System says for the last 5 to 10 years, hydrocodone-containing products, which are commonly prescribed as painkillers, have become the most abused.
We've known for quite a while that those medications are clearly in the high abuse category.
People can sometimes struggle to see the harm in drugs because they are prescribed by doctors.
Now the U.S. Drug Enforcement Administration is moving hydrocodone-containing products to a more restricted category, from a Schedule III drug to a Schedule II drug.
The different drugs are placed into schedules that kind of categorize them for their level of abuse, addictiveness, their medical properties.
Right now, hydrocodone-containing products can have up to 5 refills for a 6-month supply, and the prescriptions can be phoned or faxed in. When it moves to a Schedule II drug, there are no refills.
Schedule II requires a written prescription, and it must be delivered to the pharmacy in person or in hand.
It should allow doctors to be able to monitor the use, and so that should cut down on the abuse and the doctor shopping.
But for the millions of people who rely on hydrocodone to manage their pain, the drug isn't going anywhere.
There's some people, because of other medical conditions like hypertension, chronic kidney disease, diabetes, cannot use things like Aleve or Advil or Motrin.
However, it will now be monitored under a closer eye.
They're still very useful, but we just have to be cautious in how we use them.
Dr. Dolan says changing a drug's restriction is only one part of the solution. That is why they participate in Wisconsin's prescription drug monitoring program. It allows doctors from all over the state to see who is using opiates so they can make sure they don't overprescribe addictive medication.
All right, thanks a lot, Brittany. And those new tighter restrictions will be placed on hydrocodone-containing products by October.